I'm Nima Rajan, and this is Forum Daily Week in Review. The first session of Parliament in 2023 kicked off today with inflation, the economy, and health care in the spotlight. The NDP say they plan to push the governing Liberals to fulfill the terms of their supply and confidence agreement, such as the planned expansion of federal dental care. The Tories are set to take aim at the spending habits of the Trudeau government, while the Liberals say they will focus on tackling the high cost of living. Well, with us now to discuss the return of Parliament and its priorities is Dr. Lydia Miljan, political science professor at the University of Windsor. Dr. Miljan, welcome back to Forum Daily.
Thanks, Nima. Nice to be here.
So Parliament seems to be resuming with a lot on the docket. What do you see being the top priority when it comes to federal spending?
Well, clearly, all eyes are going to be on the inflation numbers. I mean, I think Canadians are very hard hit by just the cost of everything. You go to the grocery store and you feel like you need a second mortgage just to get a head of lettuce. And so I think that that's something that's top of mind for everyone. Clearly, we're still having interest rate hikes. And again, that's making affordability. So certainly affordability across the board, but in particular, housing is going to be top of mind, I think, for a lot of the political players.
Now, the Liberal government seems to be being pulled in both directions when it comes to federal spending, when it comes to the NDP's concerns and the Tories. How do you see the Liberals addressing these opposing concerns here?
Well, from today's appearance at the House of Commons, I think that there's just a lot of nice words that the federal government has, and a lot will have to depend on what they're going to do with the budget. Clearly, their supply and confidence agreement does hinge on them fulfilling the promises that they made to the NDP, but at the same time, they do realize and recognize that they've got to put a handle on debt and deficit spending. And they're also getting huge pressure from the provinces. So they're in a very difficult spot. How do you make sure that, the things that Canadians want, which I think we can all agree on is good health care, and that could include dental and pharmacare. But at the same time, how do you make sure that you don't make the cost of living any worse, and that you're not just spending money or printing money, which creates inflationary pressures?
Now, it seems to be quite a balancing act when it comes to these spending concerns. Now, let's touch a little bit more on the rising cost of living and the looming concerns of a recession in Canada. How do you expect the government to address this amid these spending pressures?
Well, obviously, the finance minister is going to try to downplay any concerns about the economy. And in fact, she hinted that today at the House of Commons in question period. She was saying, was it responsible for the Conservatives to keep on talking, down about the Canadian economy? But she does have to be mindful that there is, predictions that we are going to be in a recession. And I think that's in part what the Bank of Canada wants, right? Governor of Bank of Canada a few months ago said that, employment was too high and the cost of living was too much, and so that he was putting up interest rates to cool down the economy. Well, cooling down the economy does cause for recession. The hope, I think, for the Bank of Canada is that you have what's called a soft landing, that you don't have really extreme highs or extreme lows, and that you can sort of smooth out the pressures that we're having right now. It's unclear whether or not the Bank of Canada or even the government of Canada can do anything about our major issues, which tend to be supply chain related and just tend to be around the global economy, and just the fact that there are a lot of people pursuing a lot of goods that we just can't seem to get into our country.
All right, and jumping to healthcare spending, that's a major concern, especially among the premiers. The PM will be meeting with premiers next week to discuss an increase in federal healthcare spending. Can you tell us a little bit more about what you expect from this meeting and how this would likely impact Parliament overall?
Well, obviously, the provinces have been asking for an increase in spending for quite some time. We have to remember that health is provincial responsibility. And the only reason why the federal government has a say in it is because initially they promised to fund 50-50 for hospitals. They're not even anywhere near that. And I think, all the premiers are asking is, for them to help support this increasingly expensive part of government. We have huge wait times in our hospitals. It's difficult to have primary care physicians. There's doctor burnout, nurses burnout. This is a massive issue. And, everyone agrees that you just can't throw money at it. But at the same time, you do need resources to help train new professionals and get people the care that they desperately want and need.
Sounds like a lot to keep our eyes on. Dr. Miljan, thank you again for joining us today on Forum Daily News.
My pleasure, Neiman.
All right, after the break, we'll take a look at Black History Month in Canada. This month is an opportunity to highlight the contributions, impact, and accomplishments of Black Canadians to their communities and to Canadian history. This year's theme is Ours to Tell. We spoke with Dr. George Day, an expert in race and anti-racism studies with the University of Toronto, to unpack the significance of Black History Month. We'll have that interview coming up next, so stay with us. We'll be right back after a short break. February 1st marks the first day of Black History Month in Canada. Black History Month is an opportunity to highlight the contributions, impact, and accomplishments of Black Canadians to their communities and to Canadian history. The theme for this year's Black History Month in Canada is Ours to Tell. It emphasizes the importance of the stories that Black Canadians tell of Canadian history and the contributions of the Black community in Canada. Joining us now to educate us about Black History Month in 2023 is Dr. George Day, an internationally renowned Canadian scholar on race and anti-racism studies. He's also currently a professor in the Social Justice Education Department at the Ontario Institute for Studies in Education at the University of Toronto. Dr. Day, welcome to Forum Daily.
Thank you. Thanks for having me.
Great to have you, sir. Now, can you tell us a little bit more about this year's theme, Ours to Tell, and what it means for education on Canadian Black history in particular?
Yeah, no, the theme of Ours to Tell, right, comes from the idea that we have to tell our stories. We need to retell our stories, given that for the most part, our stories have been told on our behalf. So we need to restore our lives to present the story, which is not just about struggles, but also resistance, desires, pleasures, achievements, contributions. And that's why it's so important for us to tell our stories, which have been missing from discussions around African or Black history. And one aspect of telling our stories is also to make the point that we're talking about history, which is 365 days of the year, not just 1 month. And we need to tell that story.
A very good point that we need to talk about this every day of the year. Now, there's been a lot of attention drawn to anti-Black racism down in America, but this also exists in Canada. So what do we know so far about the state of anti-Black racism in our country and whether it's improved?
No, it's still a problem. It's a global problem, and Canada is not immune to it. Anti-Black racism is an international problem, and I think we need to admit to it. You cannot solve a problem if you are silent about it, if you deny it. And I think we have to be very open about it. It's not just in the US, it's in Canada. And I'm not interested in whether we are moving forward to what extent. It is still a problem. We need to address it. That's how we should take it, so that we don't get into this sense of complacency that we think, oh, well, we are better off than it was, right? It's still a problem. And I think when we hear events in the US, we have to think about, are there comparable events that we can also talk about in Canada, in Canadian context? And there are, and we should be able to speak about that so that we don't juxtapose the US with Canada. Canada becomes the good and the US the bad. That doesn't solve the problem. The problem is that we must admit anti-Black racism is a problem. It's an international problem, and Canada is not immune to it.
A very good point. It is an international problem. All right, Dr. Day. So for some further perspective, can you tell us a little bit more about the unique challenges that Black Canadians face even today when it comes to opportunities, socioeconomic disadvantages, and their overall standing in this country?
Yeah, I think one of the challenges has to do with what I talked about, the denial, right? For example, when we look at, say, questions of enslavement, right? We talk about it as if Canada was immune to enslavement, right? Canada has a history of slavery that we need to talk about. But we also have to admit that there are challenges within our institutions, whether it's education, health, law, the police, the media. And I think it's very, very important to see that these are challenges that we all are responsible to address. And it's not just a problem of, say, Black, Indigenous, and racialized bodies. Anti-Black racism is a problem for everyone, Black, white, yellow, brown, whatever you call it.
And what are your thoughts on Canada's response so far to anti-Black racism in the country? Has it been a good response so far? Is there things that the government still needs to do?
There's more to be done. I think there's more to be done. I think when we look at our educational system, to what extent is our curriculum reflective of an African history which doesn't start with slavery, an African history that goes back to pre-enslavement, an African history that sees Africa beyond colonization, an African history that sees the continuing contributions of African and Black peoples throughout our history, the totality of our experience, the totality of our existence, not just a particular period. African history did not start with 1492. And I think we need to teach about African history pre-1492. What are some of the achievements, contributions that continue to this day to inform the present? And that's how we should look at it. So there's more work to be done.
Stay with us. We'll be right back. British Columbia's move today to decriminalize possession of certain drugs is getting mixed reactions from experts and advocates. Drug users will be allowed to carry up to 2.5 grams of opioids, such as heroin and fentanyl, as well as crack and powdered cocaine, methamphetamine, and MDMA. A 3-year pilot project in BC means users will not be arrested or have their drugs seized by police. Federal Mental Health and Addictions Minister Carolyn Bennett says the plan is to move people away from the criminal justice system and toward health and social services. Well, joining us now to give us more insight into these developments is Dr. Lindsey Richardson with the BC Centre on Substance Use. She's also an associate professor at UBC. Dr. Richardson, welcome to Forum Daily.
Thank you for having me.
So what do we know so far about the science behind this decision?
Well, we've long understood that the criminalization of people who use drugs has significant negative impacts, and it does very little to discourage drug use or decrease the illicit drug supply. And so decriminalization is really seeking to reduce negative interactions with police and the harm from incarceration, for example, including physical and mental health. It's aimed to reduce stigma and the consequences of stigma, as well as longer-term impacts on things like employment or housing status or family stability.
I guess the big question here would be whether decriminalization is enough to tackle the opioid crisis and overdoses in the province.
I think it's really important to remember that decriminalization does nothing to address the toxic drug supply, which is the primary cause of the overdose crisis. And so decriminalization might not do much to reduce the risk of overdose at all. And so it's also important to remember that the change has serious limitations. So that threshold of 2.5 grams is too low to effectively decriminalize a lot of people who use drugs. And that includes people who are, for example, most commonly targeted by current enforcement efforts. And these are all things that put people at increased risk of overdose. I think another piece to remember is that it doesn't cover all substances. And so the opioid supply in Vancouver and in British Columbia right now is adulterated with fentanyl and benzodiazepines. And while fentanyl is covered, benzodiazepines aren't. And so there's a lot of question of some of the things that are key drivers of the overdose and opioid epidemic that we're currently in aren't necessarily going to be addressed by decriminalization.
It's clear that a lot more needs to be done here, Dr. Richardson. So what types of supports are needed along with decriminalization for this to successfully reduce overdoses in BC?
Well, I think it's important to remember that there's no single change or intervention that is going to be the thing that solves the overdose crisis. It really requires a lot of movement in a bunch of different areas. But I think probably the most important thing is the creation of a safe and regulated, accessible drug supply to really address the fact that the drug supply is toxic. And alongside that, we need to address the social and economic drivers of drug-related harm and really develop a comprehensive, accessible, and culturally appropriate system of treatment, harm reduction, and social care.
All right, Dr. Richardson, what about supervised consumption sites? How are they impacting the opioid crisis, and what is missing when it comes to them in particular?
Well, Supervised consumption facilities are critically important for providing a safer environment for people to use drugs, so that if they do overdose, someone can be there to address that overdose, revive them with naloxone or oxygen. But supervised consumption facilities are really limited in that not everyone has access to them, particularly in rural and remote locations, and that they are really a response to rather than the prevention of overdose. And so we really need to be thinking about ways of preventing overdose to begin with.
All right, Dr. Richardson, just a quick minute left here, but for some further perspective, we know a lot of advocates are pointing to something called a mental health crisis, according to some advocates in our country. So how closely is the mental health situation in Canada linked to overdoses and the opioid crisis?
Well, I mean, I think that's a really complex question. And a recent study by my team really identified that they are linked, that there is a linkage between mental disorders and non-fatal and fatal overdose. But again, what's important to remember is that overdose and drug use and mental disorders often have common causes, common triggers. Things like economic disadvantage, colonization, racism, isolation, disconnection, chronic pain. And so we really need to be thinking about potentially common causes of both of those things.
Lots of important points to consider. Dr. Richardson, thank you again for joining us today on Forum Daily.
Thank you for having me.
When we return, we're going to take a look at COVID-19 in Canada in 2023. Our interview with Dr. Abhishek Raut, Medical Director at Appletree Medical Group, is up next. As Canadians return to what appears to be a new normal following the peak of the pandemic, recent comments by the WHO chief remind us that the global health emergency is not over. On Monday, the head of the World Health Organization said there is no doubt that we're in a far better situation now than we were a year ago. But Director General Tedros Adhanom Ghebreyesus says COVID-19 remains a global health emergency. Now, that's despite an expert panel saying that the pandemic may be nearing a phase where higher levels of immunity can lower virus-related deaths. He's hoping that in the coming year, the world will transition to a new phase in which we reduce hospitalizations and deaths to the lowest possible level. Well, joining us now to give us more insight into the pandemic in Canada in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to be here.
So where is Canada at when it comes to the severity of the pandemic, Dr. Raut?
Well, Canada is doing well comparatively. We have about 81% of our entire population vaccinated with 2 shots. Overall, every province is reporting a vaccination rate greater than 75%. And many of us are actually quite cautiously optimistic that even the new variant, which is the XBB.1.5, also known as Kraken, is actually not going to be as severe as we thought. We initially thought that it would cause reinfections in people and cause a cascade of cases that typically we would have seen in December, January of last year. But so far, the vaccinations and our immunity has been pretty effective in keeping our COVID cases and deaths low.
Sounds like some good news, Dr. Raut. Now, going back to what Dr. Ghebreyesus was pointing to, the 170,000 people who died around the world in connection to COVID, this was in the last 8 weeks. What do we know so far about the demographics associated with these deaths?
Yeah, so we certainly have seen surges in certain weeks of COVID-19 in a few other countries. As an example, we know that a study done by Peking University showed a significant amount of increased cases in China in the past few weeks as well. And what we saw in that model was that hospital in big cities where healthcare facilities are better and more easily accessible were crowded with COVID-19 patients. But I think the issue there was also the rural areas. So many elderly, sick, and disabled in the countryside are being left behind in terms of COVID treatment, and those do build up in the number of deaths that we are seeing just across the world as well.
So how many severe cases and deaths have we been seeing in Canada within this time period?
Right. So if we look at just our time period, let's say even in the last week or so, we've seen around 11,000 cases across the country and around 229 deaths, which is not in keeping what we would have seen as a trending average as well. So we haven't seen these huge increases as some other countries have.
All right, Dr. Rout. Now, as we say, we're in this new normal amid these severely reduced restrictions. How important is it for Canadians to still take these precautions to protect from COVID? And what would this look like within this new normalcy that we're living in?
Right. So I think as physicians, this is a very classical question we get with our patients, not just for COVID, but for anything. So if you have high blood pressure and you're put on a medication, the blood pressure is good. The question is, do I really need the pill? And the answer is yes, we still need these precautions here. The precautions we're taking have been very helpful in keeping our cases at bay, but it's still important that we continue these precautions. Now, what exactly are these general precautions? It's just making sure that you're getting your vaccines and boosters, staying away from others when you feel sick, and wearing a mask when you're vulnerable, or if you're going to be around vulnerable people. So basic precautions that are very helpful here.
All right, basic precautions, Dr. Rout. About a minute left here, but last year we talked a lot about the rise of other viruses that we saw in Canada, like RSV and the common flu. So where are we at when it comes to the risk associated with these viruses?
Okay, so maybe some more good news there, but cautiously. What we have seen is that when we look at the cases of RSV and we look at the influenza cases, we're seeing levels that we would expect pre-pandemically. We're not seeing these massive surges as yet. Now, granted, with a lot of mask wearing that we did in the past few years, the surge is definitely higher than what we saw in previous years, but certainly not pre-pandemically. So as long as we're able to maintain these levels, I think we're going to be okay.
All right, Dr. Rout, a quick 30 seconds left here, but if you could leave us with one message regarding safety in 2023, what would it be?
Okay, I think the social cost of sickness is really incalculable, and the prevention is, for the most part, the most important. So education is key. Vaccinate when you can, test when you can, and wear a mask when you can.
Dr. Rout, always great having you on Forum Daily. Thanks again for your time today.
Thanks so much for having me.
All right, I'm Nima Rajan, and that'll do it for your look at important conversations from this past week. Remember, for more news on demand, you could always visit our website, thenewsforum.ca, and make sure to follow us on Facebook, TikTok, Instagram, and Twitter. Thanks again for joining us today on the Forum Daily Weekend Review, and we'll see you again next time. Have a great weekend, Canada.